The commander's vitals crashed. Blood pressure 60/40, oxygen at 81%. The ICU team swarmed him, 4 doctors, 2 residents, all failing. His hand shot up, not weak, deliberate. He grabbed the lead physician's collar. His voice was a rasp. "Get me the nurse you fired." The room froze. The doctor blinked. "Sir, we don't." "Daniels," the commander whispered. His grip tightened. "Get me Daniels now." The attending stepped back, pale. "That nurse was terminated 3 months ago." The commander's eyes didn't leave his. "Then you just killed me." 3 months ago, Alex Daniels walked out of Memorial Hospital for the last time. Not in disgrace, not in anger, just out. Security had escorted Daniels to the employee exit. Standard protocol for terminations. The guard had been apologetic. Daniels hadn't said a word. Just handed over the badge, the locker key, the access card, signed the paperwork. Left. The official reason was documented in HR files: insubordination, failure to follow physician directives. Creating a hostile work environment. The real reason was simpler. Daniels didn't respect the hierarchy. Tonight, Daniels worked the graveyard shift at Riverside Urgent Care, a county-run clinic on the east side. The kind of place that stayed open when everywhere else closed. The kind of place that saw everything the ER didn't want. It was 200 hours. The waiting room held 6 people, a construction worker with a gashed hand, a college kid with a sprained ankle. A woman with a fever her insurance wouldn't cover until morning. 2 drunks sleeping it off. 1 elderly man who just didn't want to be alone. Daniels moved through them methodically. Cleaned the construction worker's wound. 12 stitches, neat, precise, no scarring, told him to keep it dry, gave him antibiotics, sent him home, wrapped the college kid's ankle. Explained rice protocol, no lecture, just clear instructions. The kid thanked him twice, checked the woman's vitals, took her temp. 102.3, asked the right questions, ordered a rapid strep test. Positive, prescribed antibiotics, told her to follow up if symptoms didn't improve in 48 hours. She nodded, relieved. The drunks got blankets and water. Daniels checked their airways, let them sleep. The elderly man got a blood pressure check and 10 minutes of conversation. Sometimes that was the treatment. By 3:30, the waiting room was empty. Daniels restocked the suture kits. Cleaned the exam rooms, updated the supply logs, checked the crash cart, everything in order, everything in sequence, muscle memory. The clinic supervisor, Linda, mid-50s, tired eyes, kind heart, sat at the front desk with lukewarm coffee and a crossword puzzle. "You're efficient," she said without looking up. Daniels glanced over. "Thank you. Memorial's loss." Daniels didn't respond. Linda set down her pen, looked up. "You ever gonna tell me what really happened there? I got fired." I read the file. Insubordination. That's code for told a doctor he was wrong. Daniels kept wiping down the counter. "Something like that." "Were you right?" Daniels paused just for a second. "Yes," Linda nodded. Went back to her crossword. "Thought so." Daniels had been at Memorial for 2 years before the termination. ICU, night shift, the hardest cases, the dying ones, the ones no one else wanted. Daniels had thrived there, not because of ambition, not because of ego, because Daniels knew how to keep people alive when everything said they shouldn't be. The other nurses respected it, quietly. They'd ask Daniels to double-check their assessments, to watch their patients when things felt off. Daniels always said yes. The doctors were different, some appreciated it, the older ones. The ones who'd seen enough to know competence when they saw it. Others didn't. Dr. Marcus Webb had been one of them. The incident that ended Daniels' career had been simple. A patient in multi-organ failure, 42-year-old male, post-surgical infection gone septic, crashing fast. Dr. Webb had ordered aggressive IV fluids, standard protocol. Daniels had checked the patient's lung sounds, heard crackles, early pulmonary edema. The fluid was drowning him from the inside. "Doctor," Daniels had said, "we need to pull back on the fluids." "His lungs can't handle it." Webb hadn't even looked up. "The protocol is fluids, follow it. The protocol is going to kill him." Webb had stopped then, turned, stared. "Excuse me," Daniels held his ground. "His lungs are filling. If we keep pushing fluids, he'll go into respiratory failure in the next 20 minutes. We need to diurese him and reassess." "Are you a doctor, Nurse Daniels?" "No, sir." "Then do your job and let me do mine." Daniels had stood there 5 seconds, 10. Then stepped between Webb and the IV line. "I can't let you do that." The room had gone silent. Webb's face had turned red. "You're refusing a direct order? I'm protecting my patient. Get out. Not until you listen." Webb had called security. Daniels had stayed at the bedside until they arrived, adjusted the IV. Gave the patient a diuretic, documented everything. The patient stabilized. Daniels was fired the next morning. Now Daniels worked in a county clinic, no hierarchy, no doctors to fight. Just patients who needed help and a quiet place to give it. It was exactly what Daniels wanted. No complications, no past, no war. At 500, Daniels clocked out, walked through the empty parking lot. Got into a 10-year-old sedan, drove home in silence. The apartment was small, clean, minimal, a bed, a table, a chair, a coffee maker, no pictures on the walls, no personal items. Daniels didn't need them, didn't want them. The past was a weight, and Daniels had left it behind or tried to. The phone rang at 6:20. Daniels stared at it, didn't recognize the number. Let it go to voicemail. 30 seconds later it rang again, same number. Daniels answered. "Daniels," a woman's voice, clipped, professional. "This is Patricia Crane, Chief Nursing Officer at Memorial Hospital. Am I speaking with Alex Daniels?" Daniels' grip tightened on the phone. "Yes. We need you to come in." "Immediately? I don't work there anymore. I'm aware this is an emergency situation. A patient specifically requested you, by name." Daniels frowned. "What patient? I can't discuss that over the phone, but he's critical and he won't let us treat him until you're here." Silence. "Mr. Daniels," Crane continued, her voice was tight, desperate. "This man is dying and you're the only person he's asking for." Daniels closed his eyes. "I'll be there in 20 minutes. The line went dead. Daniels sat on the edge of the bed. Stared at the floor, then stood, got dressed, grabbed the keys, and walked back into the place that had tried to bury the past. Daniels arrived at Memorial Hospital at 6:48 hours. The parking lot was already full. Morning shift change. The place hummed with controlled chaos, nurses coming and going, doctors with coffee, residents dragging themselves through another rotation. Daniels parked in visitor parking, walked toward the main entrance. Hadn't been here in 3 months. The building looked the same, felt different. At the front desk, a young receptionist looked up. "Can I help you?" "Alex Daniels, I was called in." Her eyes widened slightly. She picked up the phone. "Yes, ma'am, they're here." She hung up. "Someone's coming down to meet you." Daniels waited. 2 minutes later, Patricia Crane appeared, Chief Nursing Officer, late 50s. Steel gray hair pulled back tight. She de-signed Daniels' termination papers. She walked up, extended her hand. Daniels didn't take it. Crane lowered her hand. "Thank you for coming. What's this about?" "ICU, 3rd floor, I'll explain on the way." They walked toward the elevators. Crane kept her voice low. "The patient is Commander James Halford, Joint Special Operations Command. He collapsed during a VA fundraiser last night. Massive internal bleeding, unknown source. We've had our best people on him for 6 hours. Nothing's working." Daniels listened, didn't speak. "His vitals are crashing," Crane continued. "We're losing him." And then 20 minutes ago, he regained consciousness, grabbed Dr. Webb by the collar and asked for you by name. Daniels stopped walking. Crane turned. "Do you know him?" Daniels' jaw tightened. "I need to see him." "That's not an answer. It's the only one you're getting." The elevator doors opened. They stepped inside. The ICU was on the 3rd floor. The doors opened into a controlled storm, machines beeping, staff moving fast, voices clipped and professional. Crane led Daniels down the hall, past patient rooms. Past nurses who glanced up and froze when they saw Daniels. Whispers followed. "That's the one who got fired." "What are they doing here?" Daniels ignored them. They stopped outside room 12. Through the glass window, Daniels could see the bed, the monitors, the tangle of IV lines, and the man in the center of it all. Commander James Halford, late 40s, graying hair, strong jaw. Even unconscious, he looked like command. Daniels knew that face, knew it well. Crane opened the door. Inside, Dr. Marcus Webb stood beside the bed, reviewing a chart. 2 residents flanked him. A nurse, young, competent, stressed, monitored the IV drips. Webb looked up, saw Daniels. His expression went cold. "You called them?" Webb said to Crane. "The patient requested them. The patient is delirious. We don't take orders from." Halford's hand moved. Everyone stopped. His eyes opened, barely, unfocused, but aware. His voice came out rough. "Weak but absolute." "Daniels," Webb stared. "Commander, you need to rest. We're doing everything. Get out." The room went silent. Halford's eyes found Webb locked on. Not you. Them, his gaze shifted, settled on the residents, the nurse. Out, just Daniels. Webb's face flushed. Commander, I'm your attending physician. You need to leave. Halford's tone didn't rise, didn't need to, it was an order. Webb stood there, fists clenched. Then he turned, walked out. The residents followed. The nurse hesitated. You too, Halford whispered. She left. The door closed. It was just Daniels and Halford now. Daniels stepped closer, looked at the monitors. Heart rate 118. Irregular. Blood pressure 68/42. Dropping, oxygen saturation 83%. Too low, hemoglobin 6.2, critical blood loss. Daniels scanned the IV lines, 3 units of blood running, pressors to keep his blood pressure up. Fluids. Antibiotics, standard trauma protocol, but something was wrong. Daniels moved to the bedside, looked down at Halford. Sir, Daniels said quietly. Where's the pain? Halford's eyes opened again. Focus this time. Right side, deep, feels like something tearing. Daniels pulled back the blanket, checked the surgical dressing on Halford's abdomen. Clean, no active bleeding. They said it's internal, Halford rasped. Can't find the source. Daniels' hands moved carefully, palpated Halford's abdomen, right upper quadrant. Halford winced. Here, yeah. Daniels checked the chart, CT scan results, ultrasound, labs, everything pointed to internal bleeding, but no clear source. Daniels looked at Halford's arms, saw the scars, old ones. Shrapnel patterns, burned tissue, looked at his neck. Faint scar along the trachea, looked at his chart again. Service record attached, joint special operations, 24 years, multiple deployments. Afghanistan, Iraq, Syria. Daniels' eyes stopped on one line, IED exposure, 2018, Kandahar province. Daniels set down the chart. Sir, Daniels said. Do you still have shrapnel in you? Halford's eyes narrowed. Some, they couldn't get it all. Where? Liver, right lobe, 2 fragments. Too deep to remove without risking the hepatic artery. Daniels looked at the CT scan again, zoomed in on the liver. There, 2 small metallic fragments, embedded in scar tissue. And next to them, fresh blood pooling, a slow leak. The shrapnel shifted, Daniels said quietly. Halford stared at the ceiling. How bad? Bad, it's eroding into a vessel. That's your bleed. Can they fix it? Daniels hesitated. Not here, not fast enough. You need a trauma surgeon with combat experience, someone who's dealt with retained shrapnel. They need to open you up, clamp the artery, remove the fragments, and repair the damage. How long do I have? Daniels checked the blood pressure, still dropping, 64/38. 2 hours. Maybe less, Halford closed his eyes. Then I'm dead. Not if I can help it. Halford's eyes opened, met Daniels. You can't operate, you're not a surgeon. No, sir. But I can keep you alive until we get you to one who can. Halford studied Daniels' face. Something shifted in his expression. Recognition, memory. Kandahar, he whispered. 2019, you were the medic. The one who pulled me out. Daniels didn't answer. You stitched me up in the back of a Humvee while we were under fire, kept me breathing for 40 minutes until the bird arrived. You saved my life. Daniels' jaw tightened. That was a long time ago. You changed your name? Yes, sir. Why? Daniels looked away. Because I wanted to stop being a soldier. Halford watched Daniels for a long moment, then nodded. Understood. Silence settled between them. Then Halford spoke again, weaker now. They fired you. Didn't they? Yes, sir. Why? Because I wouldn't follow bad orders. Halford's mouth twitched, almost a smile. Good. His eyes closed, his breathing slowed, the monitor alarm started beeping. Blood pressure 58/35. Heart rate 132. Daniels moved instantly, hit the call button. The door burst open. Webb rushed in, the residents behind him. What's happening? Webb demanded. He's bleeding out, Daniels said. We need to move him to surgery, now. Webb looked at the monitors, his face went pale. We don't have a trauma surgeon on call, doctor. Keene isn't in until 900. Daniels stared at him. He'll be dead by 900. Then we stabilize him and... He's past stabilization. The shrapnel in his liver shifted. It's eroding into a hepatic vessel. He needs an OR. Now. Webb looked at the CT scan, saw what Daniels saw. His expression shifted. Realization, then fear. We missed that. I know. Webb looked at Halford, then at Daniels. What do we do? Daniels stepped closer, lowered his voice. You call every trauma surgeon within 50 miles. You get someone here, and until then I keep him breathing. Webb hesitated, then nodded. Do it! He turned, started making calls. Daniels moved back to Halford's bedside. Adjusted the blood transfusion rate. Checked the IV access. Prepped a second line. Halford's eyes opened just slightly. Daniels, I'm here, sir. If I don't make it, you're going to make it. If I do, Halford's voice was fading. Thank you for Kandahar for now. Daniels' hands didn't stop moving. Didn't shake. You're not dying today, Commander, not on my watch. Halford's lips moved, barely a whisper. That's an order, Sergeant. Daniels met his eyes. Yes, sir, the monitor alarm screamed. Blood pressure 52/30, and the fight began. The room erupted into controlled chaos. Daniels didn't move from Halford's side. Blood pressure was crashing, 52/30. Heart rate spiking to 145. Compensatory response. The body was trying to survive, but it was losing. Push another unit of Oneg, Daniels said. Calm, clear. The young ICU nurse, her name tag said Martinez, moved immediately. Grabbed the blood from the warmer, hung it, opened the line. One of the residents stepped forward. We should intubate, his oxygen sat is. No, Daniels didn't look up. Not yet, but protocol says protocol doesn't account for old shrapnel and scar tissue. Daniels checked Halford's airway, ran fingers along his neck, felt the ridge of old trauma. His trachea's compromised. Intubation could collapse it. We keep him on high-flow oxygen until we have no choice. The resident opened his mouth, closed it, stepped back. Doctor. Webb was across the room, phone pressed to his ear, voice tight. I don't care if he's in surgery, pull him out. We have a JSOC commander bleeding out. We need a trauma surgeon now. Daniels tuned him out, focused on Halford, checked the abdominal dressing again, still no external bleeding. Good, the bleed was isolated to the liver. That meant time. Not much, but some. Daniels pulled up Halford's shirt slightly, palpated the right upper quadrant again. Halford's face tightened, didn't make a sound, tough, even dying. Sir, Daniels said quietly. I need you to stay awake, talk to me. Halford's eyes opened, unfocused. About what? Anything, your unit, your last deployment, doesn't matter, just stay with me. Halford's breathing was shallow. Fast, deployed 6 months ago, training op, Molly, nothing exciting. Good, keep going. Came back, retirement ceremony next month. Supposed to be done. You'll make it to that ceremony, sir. Halford's eyes found Daniels. You sure? Yes, sir. Something flickered in Halford's expression. Trust. The kind you only give to someone who's kept you alive before. His hand moved, weak. Reaching, Daniels caught it, held it. I'm not going anywhere, Daniels said. Webb hung up the phone. Turned around, his face was pale. Dr. Keene is coming in, ETA 25 minutes. Dr. Patel from County General is on standby if we need a second surgeon. Daniels checked the clock, 7-12 hours. 25 minutes, looked at the monitor. Blood pressure holding at 58/32, not rising, not falling. They had a window, barely. We need to prep him for transport to the OR, Daniels said. Get a surgical team ready, instruments, blood products, have at least 6 units available. Webb nodded, turned to the residents. You heard him, move. They scattered, Martinez stayed. She looked at Daniels. What do you need from me? Keep the blood running, watch his pressure. If it drops below 50 systolic, call me immediately. Got it. Daniels stepped back. Let Martinez take position at the monitor station. Watched her work, efficient, calm, good instincts. She reminded Daniels of someone a long time ago, a different uniform. Webb approached. Stopped a few feet away. You saw the shrapnel, he said quietly. We didn't. Daniels didn't look at him. You weren't looking for it. We did a full trauma workup. You did a civilian trauma workup. He's not a civilian. Webb's jaw tightened. What's that supposed to mean? Daniels finally turned. Met his eyes. It means you treated him like a standard bleed, but he's not standard. He's been blown up, shot, and stitched back together more times than you've done rounds. His body doesn't present the same way. Scar tissue hides things, old injuries mask new ones. You have to think different, and you know how to do that? Yes, because you were military. Daniels didn't answer. Webb stared. Who were you? Really, someone who kept people alive in places where they shouldn't have survived. Webb looked at Halford, then back at Daniels. Why didn't you tell us when you worked here? Why didn't you say you had combat experience? Because it wasn't relevant. It's relevant now. Daniels turned back to Halford. Now it has to be. At 7:21, Halford's pressure dropped, 54/28. Martinez called out immediately. Daniels, pressure's falling. Daniels moved, checked the IV line, still flowing, checked the blood, running fast, the bleed was accelerating. We need to slow it down, Daniels said. Webb stepped closer. How? Daniels looked at Halford's abdomen, thought fast, manual compression, direct pressure on the liver. It was a field technique. Not standard ICU protocol, but it worked. I'm going to compress the liver externally, Daniels said. It'll slow the bleed until we can get him to surgery. Webb blinked. That's not, it's what we did in combat when we didn't have time for an OR. This isn't combat. Right now it is. Daniels didn't wait for permission, pulled back the blanket. Placed both hands on Halford's right upper abdomen. Applied firm, steady pressure, not too hard, not too light. Just enough to compress the liver against the posterior abdominal wall. Halford gasped. His body tensed. I know, sir, Daniels said quietly. I'm sorry, but I need you to breathe through it. Halford's teeth clenched. He nodded. Daniels held the pressure, watched the monitor. 10 seconds, 20. The blood pressure ticked up, 56/30, 58/32. Holding, Martinez stared. It's working. Webb looked at Daniels' hands, at the monitor, at Daniels' face. How long can you hold that? As long as I need to. That could be 20 minutes. Then I hold it for 20 minutes. Webb didn't argue, he just watched. At 7:28, the OR called up. Ready. Webb took the call, hung up. Surgical team is prepped. Dr. Keene is scrubbing in. We can move him now. Daniels looked at Halford. Sir, we're taking you to surgery. I'm going to keep pressure the whole way. You stay with me. Understood. Halford's eyes opened, barely. Understood, Sergeant. Daniels almost smiled. Martinez and one of the residents released the bed brakes. Started rolling. Daniels walked alongside. Hands still pressed firm on Halford's abdomen. The IV lines moved with them. The monitors followed on a portable cart. They moved through the ICU, down the hall, past staring nurses, past residents who stepped aside. No one spoke. They reached the elevator. Doors opened. They rolled inside. Just Daniels, Martinez, the resident, and Halford. The doors closed. The elevator descended. Halford's breathing was labored. His eyes stayed on Daniels. You didn't have to come back, he whispered. Yes, I did. Why? Daniels looked down at him. Because you asked. Halford's eyes glistened just slightly. Thank you. The elevator stopped. Second floor, surgical wing. Doors opened. The OR team was waiting. Gowned, gloved. Dr. Keene at the front, tall, 50s, former Army surgeon. Daniels recognized the posture. Keene saw Halford. Saw Daniels' hands. You're compressing the liver? Yes, sir. Retained shrapnel, right lobe, eroding into a hepatic vessel. Keene nodded. Good call. Let's get him on the table. They rolled into the OR, transferred Halford carefully. Daniels kept pressure the entire time, didn't release until Keene's hands replaced them. I've got him, Keene said. Daniels stepped back. Halford's eyes searched the room, found Daniels. Don't leave. Daniels hesitated. Keene looked over. You ex-military? Yes, sir. Combat medic? Yes, sir. Keene gestured to the scrub station. Then scrub in, I might need you. Daniels looked at Webb, who had followed them down. Webb's face was unreadable. Then he nodded. Daniels walked to the scrub station, washed carefully, methodically, gowned up, gloved, and stepped into the OR. The surgery took 4 hours. Keene worked with precision. Calm, no wasted movement. He opened Halford's abdomen, navigated through old scar tissue, found the liver, found the bleed. There, Keene said, 2 fragments. Right where you said, Daniels assisted. Suctioned blood, handed instruments, monitored vitals. Keene clamped the vessel, removed the first fragment. Then the second, repaired the artery. Sutured the liver. He's stable, Keene said finally. Close him up. The surgical team moved in. Keene stepped back, pulled off his gloves, looked at Daniels. You saved his life. Before he even got to me. Daniels didn't respond. Where'd you serve? Keene asked. Kandahar, Helmand, Mosul. Keene nodded. Thought so, you've got the hands. He walked out. Daniels stayed until Halford was closed, until his vitals were stable, until he was moved to recovery. Then Daniels stripped off the gown, washed up, and walked out of the OR. Webb was waiting in the hallway. He looked at Daniels. He's going to make it? Yes, Webb exhaled, relief, then something else, guilt. I owe you an apology, he said quietly. Daniels looked at him. 3 months ago, Webb continued. I had you fired because you challenged me, because I thought you were insubordinate, but you were right about that patient, about the fluids. I checked the records after you left. He survived because of what you did. Daniels didn't speak. And today, Webb said, you were right again about everything, the shrapnel, the compression. The airway, if we'd followed standard protocol, he'd be dead. Webb extended his hand. I'm sorry. Daniels looked at the hand, then turned and walked away. Daniels stopped, looked back. I don't need your apology, doctor. I just need you to listen next time. And walked out. Daniels sat in the surgical waiting area. Alone. It was 11:40 hours. The surgery had ended 20 minutes ago. Halford was in recovery, stable, alive. Daniels should have left, should have walked out, gone back to the county clinic, back to the quiet. But something kept Daniels there, unfinished business. Or maybe just the need to see it through. The door opened. Martinez walked in, still in scrubs. She looked tired. He's asking for you, she said. Daniels stood. He's awake, sort of, in and out. But when he's conscious, he keeps saying your name. Daniels followed her down the hall, into the recovery wing, room 4. Halford lay in bed, chest rising and falling steadily. IV lines in both arms. Oxygen cannula, monitors beeping softly, but his color was better, his vitals strong. He was going to make it. Daniels stepped inside. Martinez stayed at the door. Halford's eyes opened. Focus slowly. Daniels, I'm here, sir. Halford's mouth twitched, almost a smile. You stayed. Yes, sir. Didn't think you would. Neither did I. Halford shifted slightly, winced. How bad was it? Bad enough. Dr. Keene removed both fragments, repaired the vessel. You'll need a few weeks of recovery, but you'll live. Halford closed his eyes. Good. I've got a retirement ceremony to make. Silence settled. Then Halford spoke again, quieter. You saved my life again. Daniels didn't respond. Kandahar was different, Halford continued. That was war, that was your job, but this, you didn't have to come back, you didn't owe me anything. You asked for me, and you came. Halford opened his eyes, looked at Daniels. Why? Daniels hesitated. Because people like you don't ask unless it matters. Halford studied Daniels' face. What happened to you? After you left the service, I became a nurse. That's not what I'm asking. Daniels looked away. I wanted to save people without carrying a rifle, and they fired you for it. They fired me for not following orders. Halford's expression hardened. Bad orders? Yes, sir. Then you did the right thing. Daniels met his eyes. Doing the right thing doesn't always protect you. Halford nodded slowly. No. It doesn't. The monitor beeped steadily. Halford's breathing was even. He was stable. Daniels turned to leave. Sergeant. Daniels stopped, looked back. Thank you, Halford said. For everything. Daniels nodded once and walked out. Daniels was halfway to the elevator when the alarm went off. A sharp, piercing sound. Code blue, room 4. Daniels sprinted back. Burst through the door. Halford was seizing, his body rigid, arched off the bed. Eyes rolled back, the monitors screaming. Heart rate 172. Blood pressure 180 over 110. Oxygen saturation dropping, 91%. 88%. Martinez was already at his side. 2 residents rushed in behind Daniels. What happened? One of them shouted. I don't know, Martinez said. He was stable. Then Halford's body convulsed. Hard, Daniels moved immediately, grabbed Halford's head, stabilized his airway, turned him on his side. Get me lorazepam, 2 milligrams IV. Now, Martinez grabbed the medication, drew it up, pushed it through the line. Halford's seizing slowed, then stopped. His body went limp, but the monitors didn't calm. Heart rate still elevated, 165. Blood pressure still high, 175 over 108, and his oxygen was still dropping, 84%, 82%. He's not breathing right, Martinez said. Daniels looked at Halford's chest. It was moving, but shallow, labored. Not enough air exchange. Daniels leaned close, listened to his breathing, heard it immediately, stridor, high-pitched, harsh, airway obstruction. His airway's compromised, Daniels said. One of the residents stepped forward. We need to intubate now. No, Daniels' voice was sharp. I told you before, his trachea is scarred. Intubation will collapse it. Then what do we do? He's not getting enough oxygen. Daniels looked at Halford's neck, saw the old scar, the one from the throat injury, years old, healed. But the tissue underneath wasn't normal. Scar tissue didn't stretch, didn't flex, and under stress, like a seizure, it could swell, could close off the airway from the inside. It's angiodema, Daniels said, swelling from the scar tissue. The seizure triggered it. Then we give him steroids and there's no time. Daniels checked the oxygen sat, 78%. Halford's lips were turning blue. The resident's voice rose. If we don't intubate, he's going to die. If we do intubate, we'll kill him faster. Then what the hell do we do? Daniels looked at Halford, at the monitors, at the clock, made a decision. Get me a cric kit. The room went silent. Martinez stared. You're going to do a cricothyrotomy here? Yes, that's a field procedure. We don't do that in a hospital. We do it when we don't have a choice. One of the residents shook his head. You can't, you're not a doctor. You're not authorized. I'm the only person in this room who's done this under fire. Get me the kit. Now. Martinez didn't hesitate. She ran to the supply cabinet. Pulled out the emergency cricothyrotomy kit, handed it to Daniels. Daniels ripped it open, laid out the instruments. Scalpel, bougie, track tube, clamps. Halford's oxygen sat hit 74%. Daniels positioned Halford's head, extended his neck, palpated the landmarks, found the cricothyroid membrane, the small space between the thyroid and cricoid cartilage. One chance, one cut. Daniels' hands didn't shake. Someone call Dr. Keene, Daniels said. Tell him what's happening and get a crash cart in here. Martinez grabbed the phone. The resident just stared. You're really doing this? Yes, if you're wrong, then he dies, but if I don't do it, he dies anyway. Daniels took the scalpel, made a vertical incision, 1 inch, through the skin. Through the tissue, blood welled. Daniels didn't stop, found the membrane, made a horizontal stab incision, through the membrane, into the airway, a rush of air. Daniels inserted the bougie. Threaded the track tube over it, advanced it into the airway, removed the bougie, inflated the cuff, connected the bag valve mask, squeezed. Halford's chest rose. Daniels squeezed again. Another breath. The oxygen saturation started climbing, 76%, 80%, 85%. Halford's color improved, the blue faded, the monitor settled, heart rate dropping. 145, 130, he was breathing. Daniels stepped back, blood on the gloves, on the gown, but Halford was alive. Dr. Keene burst through the door 30 seconds later. He saw the track tube, saw the setup, saw Halford's vitals. He looked at Daniels. You did a field cric in the ICU? Yes, sir. Why? Because intubation would have killed him. His airway was compromised by scar tissue. It swelled shut during the seizure. I had to bypass it. Keene moved to the bedside, examined the track placement, checked the airway, listened to the breath sounds. It's perfect, he said quietly. He turned to Daniels. Where did you learn to do this? Forward operating bases, when we didn't have time to wait for a surgeon. Keene nodded slowly. You just saved his life again. The door opened. Doctor. Webb stepped in. He saw the scene, the blood, the track tube, Daniels standing beside the bed. What happened? He seized, Keene said. Airway swelled shut. Nurse Daniels performed an emergency cricothyrotomy. Webb stared. Without authorization. Without time, Keene corrected. If Daniels had waited for authorization, Commander Halford would be dead. Webb looked at Daniels, at Halford, at the monitors showing stable vitals. You can't just... Webb stopped. His voice faltered. You can't do that without... Without what? Keene interrupted. His voice was cold. Without a doctor's permission, without following protocol, doctor. Webb protocol would have killed this man. Daniels saved him. Webb's jaw tightened. He didn't respond. Keene turned to Daniels. You need to stay until he's stable. I want you monitoring him. Sir, I'm not staff here. You are now. Keene looked at Webb. Reinstate Nurse Daniels immediately. Full privileges. ICU assignment. Webb's face flushed. That's not my call. I'd have to go through administration. Then go through administration. But Daniels stays on this case. That's non-negotiable. Webb stared at Keene, then at Daniels. Fine, he said quietly. I'll make the call. He walked out. Keene placed a hand on Daniels' shoulder. You did good work today, he said. Better than good. You did what needed to be done. Daniels looked at Halford. I just kept him alive. That's the job. Keene smiled slightly. Welcome back, Nurse Daniels. He left. Martinez approached. She looked at Daniels with something close to awe. That was incredible, she said. Daniels pulled off the gloves, dropped them in the bin. It was necessary. Most people wouldn't have known what to do. Most people haven't seen what I've seen. Martinez studied Daniels' face. Where were you before here? Daniels met her eyes. Somewhere I don't talk about. She nodded, didn't push. I'll stay with him, she said. You should rest. I'm fine. You've been standing for 6 hours. Daniels looked at Halford. At the monitors, at the steady rise and fall of his chest. I'll rest when he's stable. Martinez smiled slightly. You sound like a soldier. Daniels didn't respond, just pulled up a chair. Sat down beside the bed and waited. At 16:20 hours, Halford's eyes opened. He looked around, confused, felt the tube in his throat, tried to speak. Daniels leaned forward. Don't talk, sir. You have a track tube. You had an airway emergency. I had to bypass it. Halford's eyes found Daniels, widened slightly. Daniels nodded. You're okay. You're breathing. You're stable. Halford's hand moved, reached toward Daniels. Daniels caught it, held it. Halford squeezed, weak, but there. His eyes said everything his voice couldn't. Thank you. Daniels squeezed back. You're going to make that ceremony, Commander, I promise. Halford's eyes closed, but his hand stayed in Daniels. And for the first time in 3 months, Daniels felt like a medic again. Halford was moved to a private recovery room at 1900 hours. Daniels stayed with him, monitored the track. Checked vitals every 30 minutes, adjusted oxygen flow, documented everything. Martinez brought coffee at 2000 hours, set it down beside Daniels without a word. Daniels nodded thanks. By 2200 hours, Halford's vitals had stabilized completely. Heart rate 88, blood pressure 118/76. Oxygen saturation 97% on minimal support. He was going to be fine. Dr. Keene came by at 2230. Reviewed the chart, examined the track site. Clean work, he said. No infection, no complications. We'll keep the track in for 48 hours, then reassess. If the swelling's down, we can remove it. Daniels nodded. Keene looked at Daniels. You should go home, get some sleep. We've got this. I'd like to stay until he wakes up. Keene studied Daniels for a moment, then nodded. Understood. He left. Halford woke at 1:20 hours. His eyes opened slowly, focused, aware. He saw Daniels sitting in the chair beside the bed. Daniels stood, moved closer. Sir, you're awake. Halford nodded, reached for his throat, felt the track tube. His eyes asked the question. You had a seizure, Daniels explained quietly. Your airway swelled shut from old scar tissue. I had to perform a cricothyrotomy to bypass it. The tube stays in for a couple days. Then we'll remove it. You'll be fine. Halford's hand moved, gestured for something to write with. Daniels grabbed a notepad and pen from the bedside table, handed them over. Halford wrote slowly. His handwriting was shaky but legible. How many times are you going to save my life? Daniels read it, almost smiled. As many as it takes, sir. Halford wrote again. You didn't have to stay. Yes, I did. Why? Daniels looked at him. Because that's who I am. Halford held Daniels' gaze, then wrote one more line. You're a good medic, better than good. Daniels' throat tightened. Thank you, sir. Halford set down the pen. His eyes were heavy, tired, but grateful. He reached out his hand. Daniels took it. Halford squeezed once. Then his eyes closed. He drifted back to sleep. Daniels stayed for another hour, then quietly left the room. The hospital was quiet at 2:30 hours. Daniels walked through the empty corridors, past darkened patient rooms. Past the nurse's station where Martinez sat charting, she looked up. Heading out? Yeah, he's going to be okay because of you. Daniels didn't respond. Doctor. Webb put in the paperwork, Martinez continued. You're officially reinstated, full ICU privileges, day shift, better pay, they want you back. Daniels stopped walking, turned. I didn't ask for that. I know, but you earned it. Daniels looked at her. I don't want it. Martinez blinked. What? I don't want to come back here. Why not? You just saved a man's life. Twice you proved you belong here. I don't belong here, Daniels said quietly. I never did. Martinez stood, walked around the desk. You're one of the best nurses I've ever seen. You think like a doctor, you move like a soldier, you care like... She stopped, searched for the word. Like someone who's lost people before. Daniels' jaw tightened. This hospital needs you, Martinez said. Patients need you. They'll survive without me. But you could do so much more here. You could teach, you could lead. I could follow orders I don't agree with. I could fight doctors who won't listen. I could watch people die because protocol mattered more than judgment. Daniels shook her head. I left that world once. I'm not going back. Martinez stared. Then why did you come back today? Because someone I respected asked me to. And now I go back to where I belong. Daniels turned and walked toward the elevator. Martinez called after her. Where's that? Daniels didn't answer, just kept walking. Daniels stopped by administration on the way out. Patricia Crane was still there, working late. She looked up when Daniels entered. Nurse Daniels, I heard what happened. Commander Halford is stable because of you. He's stable because Dr. Keene is a good surgeon, Crane stood. Dr. Webb submitted your reinstatement paperwork. I've already approved it. You start Monday. Day shift, ICU, full benefits, and a formal apology in your personnel file for the wrongful termination. Daniels looked at her. I'm not coming back, Crane blinked. Excuse me, I appreciate the offer, but I'm not interested. You can't be serious. I am, Crane stepped around her desk. Nurse Daniels, you just saved the life of a decorated military commander. You performed procedures most nurses would never attempt. You proved beyond any doubt that you belong on this staff. I proved I'm good at my job, Daniels said. That doesn't mean I want to do it here. Then where? Somewhere quiet. Somewhere I don't have to fight to do what's right. Crane stared. You're walking away after everything. I'm walking away because of everything. Daniels turned toward the door. Wait, Crane's voice was softer now. Can I ask you something? Daniels paused, looked back. Why did you become a nurse? Crane asked. After the military, after whatever you were. Why this? Daniels was quiet for a long moment. Because I wanted to save people without killing anyone else in the process. Crane's expression shifted, understanding, sadness. And we ruined that for you, she said quietly. No, Daniels said. You just reminded me why I left in the first place. She walked out. Daniels was in the parking lot halfway to the car when a voice called out. Daniels! She turned. Dr. Webb stood under a streetlight, hands in his coat pockets. He looked tired. Older than he had that morning. I wanted to apologize, he said. Not just for today, for 3 months ago, for not listening, for not seeing who you were. Daniels didn't speak. Webb stepped closer. You were right about that patient, about Commander Halford, about everything, and I was too proud to admit it. I don't need your apology, doctor. Maybe not. But I need to give it. Webb's voice was quiet. You're the kind of nurse every hospital should have, the kind who puts patients above ego, above politics. Above everything. Then why did you fire me? Webb looked away. Because you made me feel small and I didn't know how to handle that. Silence. I'm sorry, Webb said finally. For all of it, Daniels studied his face, saw the regret, the shame. Apology accepted, Daniels said, but it doesn't change anything. You're not coming back. No, Webb nodded slowly. I understand. He extended his hand. This time Daniels took it. They shook once, then Daniels let go. Take care of him, Daniels said. Halford. He's been through enough. We will. Daniels turned and walked to the car, got in, started the engine, and drove away. At 600 hours, Daniels returned to Riverside Urgent Care. Linda was at the front desk. She looked up, smiled. You're back. I'm back. How'd it go? He's alive. He'll recover. Linda studied Daniels' face. And I'm done with that place. Linda nodded. Good, we need you here more anyway. Daniels walked to the locker room, changed into clinic scrubs, clipped on the badge. Walked back out to the floor. There were already 3 patients waiting. A kid with a fever, an elderly woman with chest pain, a construction worker with a nail through his hand. Daniels got to work. 2 days later, a black SUV pulled up outside Riverside Urgent Care. Daniels was restocking exam rooms when Linda knocked on the door. You've got a visitor. Daniels looked up. Who? Military. Says he knows you. Daniels' chest tightened. She walked to the waiting room. Commander James Halford stood near the window, dressed in civilian clothes. A bandage visible on his neck where the track had been. He looked thinner, tired but alive. He saw Daniels, straightened. Sergeant, he said quietly. Commander, you should be resting. I am. But I had to come. Halford stepped closer. They told me you didn't come back, that you turned down reinstatement. Yes, sir. Why? Daniels looked at him. Because I don't want to be someone's hero, I just want to do my job. Halford studied her face, then nodded slowly. I understand that. He reached into his jacket, pulled out a small wooden box. Handed it to Daniels. What's this? Open it. Daniels opened the box. Inside was a military challenge coin, JSOC insignia, gold and black. On the back, engraved words, for saving my life when no one else could. J. Halford. Daniels stared at it. You don't owe me anything, sir. I owe you everything. Halford's voice was steady. Twice you pulled me back from the edge. Once in Kandahar, once at Memorial. Both times you did it without hesitation, without recognition. Without asking for anything in return. Daniels closed the box. That's the job. No, Halford met her eyes. That's who you are. Silence. You saved my life so I could retire with dignity, Halford continued. So I could see my family again, so I could finish what I started. That's not something I'll ever forget. Daniel's throat tightened. Thank you, sir. Halford extended his hand, Daniels shook it, then Halford did something unexpected. He saluted, sharp, crisp. Full of respect, Daniels hesitated, then returned it. They held the salute for 3 seconds, then dropped their hands. Take care of yourself, Sergeant, Halford said. You too, Commander. Halford turned and walked out. Daniels stood there, holding the box. Linda appeared beside her. Who was that? Someone I used to know. He looked important. He is. Linda glanced at the box. What'd he give you? Daniels opened it, showed her the coin. Linda read the engraving. Looked at Daniels. You saved his life. I did my job, Linda smiled. You keep saying that, but I don't think you realize what it means. Daniels looked at her. It means you're exactly where you're supposed to be, Linda said. Not in some big hospital, not chasing recognition, but here, helping people who need it, quietly. Without asking for anything back, Daniels closed the box. That's all I ever wanted. I know, Linda squeezed her shoulder, and that's why you're one of the good ones. She walked back to the desk. Daniels looked down at the coin one more time, then slipped it into her pocket. That night Daniels worked the graveyard shift, treated a sprained wrist, a migraine, a panic attack. A diabetic episode, restocked supplies, cleaned exam rooms, updated charts. At 400 the clinic was empty. Daniels stood at the window, looked out at the dark street, the quiet. Felt the weight of the coin in her pocket. Thought about Kandahar, about Halford, about Memorial Hospital, about the life she'd left behind, and the life she'd chosen instead. She pulled out the coin. Turned it over in her hand, for saving my life when no one else could. Daniels closed her fist around it, then put it back in her pocket, turned away from the window, and went back to work, quietly. Efficiently invisible, exactly the way she wanted it.